Hi, I'm Dr. Patrick Danzy, and I'd like to introduce the Axial Trac Hybrid Chiropractic Table. I've been utilizing flexion distraction and decompression in my practice for over 25 years, and I've had good results. However, I've been frustrated by the limitations. Flexion distraction frequently just doesn't produce enough traction. The table will bottom out before the tissues are adequately stretched. Decompression is a very nonspecific technique. For example, it's impossible to target just the L4-5 level on the right side. To address these shortcomings, I designed the Axial Trac, the first table that combines the movements of flexion distraction and decompression simultaneously. The movement is so unique it was granted a U.S. patent. The indications for Axial Trac include lower back pain, sciatic neuralgia, disc protrusions, facet syndromes, and many other conditions that are commonly treated with either flexion distraction or decompression. The hallmark of the Axial Trac is a sliding upper pelvic section that is mechanically forced into distraction as the table is flexed. I call this enhanced flexion distraction. The flexion movement stretches the paraspinal muscles and opens the facet joints, while the added distraction decompresses the discs and opens the IVFs. The traction handle is mounted to a non-sliding portion of the pelvic section so it does not move away from the doctor as the table is flexed. A switch in the traction handle controls the spring tension. This allows the doctor to balance the table forces as different amounts of traction are applied. A gauge near the traction handle allows the doctor to observe and record the amount of additional traction that is delivered with each flexion stroke. This makes the technique very reproducible. Axial Trac's hybrid design allows a tremendous amount of treatment flexibility. With the traction bar fully elevated, there's about 2 inches of traction delivered with full flexion. In this position, the table performs similar to a conventional flexion distraction table. With the traction bar fully lowered, there is over 3 additional inches of traction with full flexion. When used in this manner, not only is there 3 times more traction, but it is delivered at a 3 times greater velocity. This leads to frequent audible releases and better subluxation correction. This configuration can also be used for patients that cannot tolerate much flexion but still require significant distraction. In this instance, the table is only flexed halfway down, but over 2 inches of additional traction are still delivered. For patients with very tender spines, this configuration with full flexion and a very light spinal contact works well. To reduce a disc protrusion, for example, L4-5 on the left, I would contact L4 on the left, laterally flex the table to the right, begin with 0 added traction, and gradually increase the traction on subsequent visits. Axial Trac is safe and patient-friendly because all the movements are performed manually to the patient's tolerance and monitored by the doctor's tissue tension sense. Axial Trac can be the answer to all your table needs. To purchase just a flexion distraction table and a decompression table will cost anywhere from $15,000 to $110,000. You can have an Axial Trac delivered to your office for less than $10,000. For the doctor who wants to conserve office space, get the most function out of one table, and do it at the most reasonable price, Axial Trac is the answer.